Hello everyone, my name is Dr. Yonit Arthur. I'm an audiologist and strength coach, and I specialize in vestibular disorders. Welcome to my channel, The Steady Coach. Today we're going to be talking about cervicogenic dizziness by request of one of my subscribers. Now, many of you report neck pain and pressure with your dizziness, and some of you have actually been diagnosed with cervicogenic dizziness. So I wanted to give you my take on what cervicogenic dizziness is and isn't. So the idea behind cervicogenic dizziness is there are reflexes that connect our neck to our ears to our brain. So we've learned from past videos that one of the most important vestibular reflexes in humans, in other words, a reflex that helps keep your balance, is the vestibulo-oculo reflex, which is that reflex that allows you to turn your head and keep your eyes stable on whatever you're looking at. But there are other reflexes as well, and those reflexes can come from other parts of our body. Notably, there's the VCR, which is the vestibulo-colic reflex, and the VSR, the vestibulospinal reflex. There are a few others as well that connect other parts of your body to your eyes. But the gist of it is this. Your neck is also sending inputs to your ears and your brain to tell your brain where you are in space and to help keep your head centered and stable while you're trying to look at something or trying to balance. So the idea behind cervicogenic dizziness, and this was developed, by the way, in the 1920s, is that if something is messed up about the communication between your neck and your ears or your neck and your eyes, your brain may not have a good sense of where your neck is in space, or it may be getting bad information from your neck. And in those cases, your head may feel wobbly, you may have dizziness, you may feel heaviness in your head, neck pain, and so on. And you may not know this, but this is actually kind of controversial. There are some clinicians who believe cervicogenic dizziness is not a thing, and there are others who believe cervicogenic dizziness is actually a thing. And I'm going to clear up some of that confusion right now. So the studies from the 1920s clearly show that when you mess with some of the nerves connecting the neck to the ears or the neck to the eyes, people really do develop some difficulties stabilizing their heads. But as you know, if you've been watching this channel, there's another potential cause of cervicogenic dizziness type symptoms. And that is that the nerve signals might be coming in just fine, but the brain isn't coordinating them. In other words, the brain is making a mistake. It's getting perfectly good information from the ears, eyes, and neck, but it's just not coordinating that information correctly. And when it mispredicts, in other words, when it expects something and something else is actually what's happening, you end up feeling dizzy. There's a lack of coordination between your senses. So how can you tell which one it is? Well, here are some pretty good indicators. If you have true dizziness that's coming from problems in the nerves in your neck, that is usually preceded by an identifiable major injury, like car accidents in which your neck is subjected to violent head movement. There should also be some consistency about what brings on your symptoms. So, for example, if you were to turn your head and that brings on symptoms, turning your body like this without moving your head would not bring on symptoms. So in other words, only movements of the neck would bring on symptoms. The final indicator is that movements of the neck can also relieve symptoms. So if you find yourself in a position like this and you have cervicogenic dizziness, turning your neck back to neutral should relieve your symptoms. And also remember that we do expect there to be adaptation from the brain, so we wouldn't expect this set of symptoms to suddenly arise months after the injury. It would occur with the injury and then get better over time. You also wouldn't expect to see any of the fluctuations and inconsistencies that you see with neural circuit dizziness. And if you want to learn more about that, I will link to a video above and below that goes into how to identify whether you have neural circuit dizziness or not. But rest assured that I see a lot of people with cervicogenic related symptoms. And by that I mean they don't meet the criteria that I just talked about, having had an injury, having a clear abnormality on a scan, having dizziness only with movements of the neck. So diving into the research on cervicogenic dizziness, It turns out that people who've been diagnosed with cervicogenic dizziness follow some of the same patterns that we see with triple PD, MDDS, and other forms of neural circuit dizziness. The biggest predictors of someone's handicap or functional disability from his or her cervicogenic dizziness are anxiety and fear of movement. Is this starting to sound familiar? So the latest research is very clear that cervicogenic dizziness is very often heavily psychosocial. In other words, there are emotional and social factors that are affecting how severe someone's dizziness is. And that's from the mainstream literature. You know, here on this channel, we take it a step further and talk more about the emotional and psychological factors, the neurochemical factors that can lead to chronic dizziness. So just to recap, there may be physical contributions to the source of the cervicogenic dizziness, but what causes it to perpetuate and become a long-term problem are psychosocial factors. So if you meet the criteria that we discussed for plain old cervicogenic dizziness versus a neural circuit form of cervicogenic dizziness, physical therapy is going to help you. There's evidence that manual manipulation of the neck can really help, like manual muscle therapy. There's some evidence that strengthening some of the deep neck flexors can help. And then there are forms of vestibular therapy or vestibular therapy types, subtypes that can really help. If you have the neural circuit dizziness form of cervicogenic dizziness, like you don't meet the criteria we talked about a few minutes ago, then these techniques may still help you, and we'll talk more in depth about them in a moment. It's really important to understand that what's driving your cervicogenic dizziness isn't an abnormality in your nerves or an injury to your nerves that needs to be treated. It's this fear, stress cycle that fuels neural circuit dizziness in general. And I will link above and below to another video where I discuss more about that. The good news, though, is that if you have a neural circuit form of cervicogenic dizziness, you can treat it using a lot of the same techniques as we would for someone who had a more standard type. But again, very important to understand that the fuel for it is this fear avoidance stress cycle, and you're going to have to address those as well if you're going to get better. So the types of exercises that help people with cervicogenic dizziness are roughly divided into two categories. One category is proprioceptive training. In other words, you're trying to teach your brain to coordinate with your neck better. And the other category is more vestibular training, trying to teach your neck and your ears to coordinate properly. And by ears, of course, I'm referring to the vestibular system, so the balance system, the balance organs that are contained deep within your ear. You're trying to strengthen those reflexes so then they are sending good information to the brain. Or in the case of neural circuit dizziness, so the brain remembers what good information looks like, and it's getting a clean signal, a very clean signal from those senses, so that it can then start to make good predictions again and coordinate the senses properly. So that distinction is less important in this case with cervicogenic dizziness. I know I've said this twice already, I'm going to say it just one more time. The reason the distinction is important is because with neural circuit related cervicogenic dizziness, you have to address the fear and stress that is driving the dizziness to happen in the first place. Your neck is not the problem, your brain is. But training the brain and the neck together using these exercises can be helpful. Okay, so for these first sets of exercises, what you're going to do is grab a headlamp, and ideally you'd also have a laser pointer that you can attach on top. So, you know, one of those little red laser pointers that you use to get your cat to chase something, okay? I don't have one of those handy, but if you don't have one handy either, that's fine, just use a headlamp. Then you're going to print out or draw some simple shapes like circles, like triangles, maybe the letters of your name in big letters, and you're going to attach them on a wall in front of you. Or you can print out something like this, which is a maze, okay? You're going to attach one of those to the wall in front of you, starting with the simple shapes and progressing to the maze. Sitting in front of the wall and with the shape or the maze in front of you, you're going to start using your head movement to trace the shape. So I'm tracing the simple circle here. I'm going to progress to the letter A, and then as I get better with that, I'm going to start tracing my way through the maze. So as you get better and better at keeping your lines accurate, which by the way, you may not be good at first, you can start to progress this exercise by changing your position. Once you've done this seated and you're doing really well at it, you can progress to standing with your feet nice and wide like this, so you have a wide base of support. Then you could stand with your feet together, which makes it harder. And to progress from there, you can take a staggered stance with one foot in front. And then from there, you could even stand on a cushion or a pillow while you're doing this tracing. That will again increase the difficulty of the exercise. Once you've done all of those progressions with your eyes open, you could start doing these with your eyes closed. So starting with the simple shapes, you'll be sitting, you'll have your headlamp on, you're going to trace the shape with your eyes closed, and you're going to progress through all of the different exercises, except perhaps not the maze, since you won't be able to actually see the maze while you're doing it. You're going to progress through the simple shapes and the letters with your eyes closed, starting from a sitting position all the way to an unstable surface. So that's a summary of the proprioception style exercises that you can do for cervicogenic dizziness. The other types of exercises that you can do for cervicogenic dizziness are more in the style of standard vestibular exercises. Here are just a few examples. One of them is called visual tracking with head movement. So you're familiar probably already with the exercise where you hold an object in front of you, just using this little remote control, and you just follow it with your eyes. For cervicogenic dizziness, you're going to follow it with your eyes and your head. So you're going to hold the object in front of you, it's going to move, and your neck and eyes are going to move with it as well. Okay? You're going to do this side to side, you'll do this up and down, and then to both diagonals as well, diagonal and diagonal. Once you've done this sitting, you're going to progress that particular exercise by making your base less stable. So same progression as we used for the proprioceptive exercises, where we start standing with a wide base of support, then narrow, then staggered, then even standing on something that is unstable. The second type of exercise you can use is your very standard VOR exercise, vestibulo-ocular reflex exercise, which I call the head shake no. You're going to hold your object in front of you, you're going to shake your head no, back and forth, as you try to keep your eyes stable on the object. You're going to do the same thing up and down, nodding your head yes, and then you can do it again to both diagonals, moving up and moving down. Okay? With cervicogenic dizziness, the speed of your movement is going to determine the intensity or how hard it is. So with standard VOR exercises, what I'll often do is people will make very small movements because I'm just worried about them stabilizing their eyes. In other words, stabilizing their gaze, looking at the object and keeping their gaze stable. But with cervicogenic dizziness, we know that it's the head movement that's causing some of the dizziness. So for you guys, you may want to increase the range of motion and make it a little bit slower. And then you can progress to faster, but keeping that bigger range of motion, because again, we're trying to get some more head movement than we would for the regular head shake no and nod yes exercise. And again, you can progress them the same way as we did for the others, starting sitting, then standing, then narrow, then staggered, and then on an unstable surface. Now, general balance exercises can also help with cervicogenic dizziness, and that's again because the brain isn't coordinating the senses properly and/or the senses aren't giving the brain good information. I'm not going to go into an exhaustive list of balance exercises here, but that could be a topic of a future video if you guys are interested in that. So I hope that was helpful for you guys and you have a better understanding of the differences between true cervicogenic dizziness, in other words, dizziness coming from the neck, versus a neural circuit form of cervicogenic dizziness that involves the neck, that involves the head feeling heavy, that involves neck pain, but isn't coming from a neck injury, it's coming from the brain. And the brain not coordinating or not predicting sensory information properly. As always, if you found this video helpful, please like, share, and subscribe. Drop your questions and comments below, and I will talk to you soon.